Thank you for coming to my virtual poster. My name is Lauren Gilbert, and I'm currently a clinical assistant professor at the University of Houston College of Medicine. I am also the recipient of the pilot grant from the Health RCMI at the University of Houston. Today, I'll be presenting my pilot work, which is entitled Exploring the Provider and Organization Level Barriers to MOUD Treatment for Black Americans. This research is vital as we need to address the ongoing opioid crisis, which has seen in recent years a continuing rise in opioid-related deaths, especially in Black communities. Many of these deaths are being attributed to the inclusion of synthetic opioids in other drug supplies. In order to address the opioid crisis, considerable efforts have been implemented to increase treatment for those struggling with opioid use disorders. As part of these efforts, there's been an increase in accessibility and availability of MOUD. MOUD is medication for opioid use disorders and is considered the gold standard of treatment. It's contributed to significant reductions in opioid use, criminal activity, overdose, and other risky behaviors. MOUD is an umbrella term that includes three key medications. The first is Methadone, which is highly regulated and only available in opioid treatment programs. Methadone is also highly disruptive to those who are using this medication, as they have to go to treatment to receive their medications, whether that's every day, every few days, or maybe once a week. However, we have other medications, including buprenorphine and naltrexone, that can be office-based, allowing for a more chronic disease management model of opioid use disorders. However, buprenorphine is limited in that it can only be prescribed by waivered providers who go through SAMHSA and DEA training in order to become waivered. And even then, they have a limit to how many patients they can treat with this medication, depending on how long they have been waivered. Even more tragically, Black Americans are less likely to receive and complete any type of opioid use disorder treatment. And as a result, there is a health disparity that we can see. So as part of my pilot project, I wanted to explore providers and organization level barriers to providing this medication for opioid use disorder to Black patients with OUD. So for the first specific aim, I'm looking at providers, both waivered and unwaivered, so those who can currently prescribe the buprenorphine and that office-based treatment, and those who are not currently waivered. There's been a recent push in years to get more providers waivered who are part of primary care and emergency medicine providers. And so I am looking to interview those types of providers as well as other individuals who are dealing with opioid use disorders or those who are prescribing opioids. These are qualitative interviews, and I'm hoping to get a total of 20 interviews by the end of this project. As part of some of the topics that are covered in this interview with providers include their values, their goals, their perceived need for change, and also their social networks. Some of my early preliminary findings are here on the slide, including how individual providers are framing the opioid epidemic, whether they're seeing it from their own perspective and those individuals who either have chronic pain or acute pain who have been prescribed opioids and them falling into opioid use disorders, or if they have an understanding of the opioid epidemic now in the current third wave of this increase in fentanyl-laced drug supplies. It seems that there is a limited knowledge or understanding of how the opioid epidemic has changed in recent years in this third wave, and dealing with these synthetic opioids being contaminated into other drug supplies. There's also been a lot of discussion among my participants dealing with stigma. So preventing the stigma that prevents people from accessing MAT treatment and mental health services in general. And this is both internal, something that they feel they don't want to be labeled as that, but there's also an external stigma. So the providers, their families, the staff at these different organizations, they're labeling these individuals as some sort of other than that type of patient. There's also been several discussions about holistic approaches to deal with the opioid epidemic and specifically dealing with OUD in Black communities, having to address the trauma and some of those larger issues of the social determinants of health. But there's also a real optimism, and there's a need for collaboration with community partners and other stakeholders to address this problem. The second specific aim is dealing with organizations. And so for this specific aim, I am using a sequential mixed method design of quantitative surveys first, and then following up with qualitative interviews. To date, I've completed 14 surveys and 2 follow-up interviews. And overall, some preliminary results include that there is a recognition that it's important to target Black communities for these different organizations who are providing the medication for opioid use disorder. But to date, very few have actually implemented any culturally responsive strategies to reach this specific population. And so there is room for improvement. And in my 2 follow-up interviews, they both recognize the importance of that, but we're unsure what that would look like or what those programs or culturally responsive strategies would look like. And so I want to thank you for coming to my virtual poster presentation. I would love to hear more from you. My email address is here. It's lrgilbe2@central.uh.edu. And I look forward to talking with you more at this conference. Have a great day.